Maharashtra's health insurance scheme is getting discussed all over because the revamped health insurance scheme is providing health coverage of 5 lakh to all the citizens of Maharashtra. And to talk more on this scheme, what are the other conditions related to this scheme, I am joined by Mr. Milind Mhaiskar, Additional Chief Secretary, Public Health Department of Government of Maharashtra. Thank you so much, sir, for talking to ET now.
My pleasure.
Yes, sir. Sir, just want to understand your this revamped health insurance scheme, Mahatma Jyotiba Phule Arogya Yojana, is getting a lot of traction all over. We are also getting so much queries about this scheme. So, is it right to say that every citizen of Maharashtra is eligible for the scheme free of cost up to the 5 lakh rupees?
Yes, every citizen of Maharashtra will be eligible for this scheme. And as you know, Maharashtra has been a pioneering state in this scheme right from the year 2012.
Okay.
One of the most initial entrants into this scheme Maharashtra was. And we are running this scheme since 2018, 2012. And then the most favorite scheme of our Honorable Prime Minister, Mr. Narendra Modi ji, came in 2018, which is called Prime Minister's Jan Arogya Yojana. Yes. So we merged that in 2018. And then our Chief Minister and both Deputy Chief Ministers decided that we should go for the universalization of the scheme. Nobody should be left because health is important for everybody. So that is why we decided that every citizen of Maharashtra should get this scheme. And after the tendering process and all the formalities, the scheme has started rolling from the 1st of July 2024, where everybody will be eligible for this scheme.
Irrespective of their income, irrespective of their qualification?
Exactly. Earlier, to give you a small background, earlier only poor people like holding orange and yellow ration card, Antyodaya, they were eligible. But now everybody, white ration card also is eligible. And if you don't have a ration card, Aadhaar card can be used for that. And we need an Ayushman card which can be done on a mobile app very quickly in 2 or 5 minutes. And once you get registered on this Ayushman Bharat portal, immediately you can get a cashless treatment up to 5 lakh rupees per year per family.
Okay.
Yes.
So it's a right to say that richest person of state of Maharashtra to the poor people of Maharashtra, all of them are covered for 5 lakh rupees of insurance.
Yes. The another situation is that whatever scheme we were running till now, Maharashtra's roughly 2.25 crores, Sawa do crore families were covered. Maharashtra has roughly 2.72 crore families with a population of 12 crores. So we thought that why leave that small section also? Let's cover them. And that is why it has become a universal scheme.
Universal.
Yes.
Sir, one question always arises in these kind of schemes that you always tend to choose only government hospitals. So treatments are not available at the private hospitals, and treatments also get restricted to few treatments only. All treatments are not covered under these kind of schemes.
Yeah, that's a good question. But let me clarify that we are now in the new scheme, we will be empaneling 1900 hospitals all across Maharashtra.
Okay.
Out of which only 450 hospitals are government hospitals.
Okay.
Apart from that, even if there is a government hospital, the citizen has freedom to choose whichever hospital he likes.
Okay.
So that is why freedom is there. But at the same time, our focus is to strengthen the public health machinery also, government hospitals also from this scheme, so that they get more patients, they get more infrastructure, better infrastructure. Secondly, for your question, we are covering around 1356 different procedures in this scheme.
Okay.
So virtually that covers everything.
Okay.
That covers all the types of cancers, heart disease, angioplasty, kidney diseases, and obviously all the other normal procedures. So that's, I think, enough number of procedures that are getting covered.
So you mean to say that around 1500 hospital under the schemes are private hospitals, and the citizens are entitled to take treatment at the private hospital also up to the 5 lakh rupees.
Exactly. Yes. That is the scenario.
Okay.
Yeah.
Sir, one more thing, because in Maharashtra, state of Maharashtra, there are many residents from outside the other states also. So are they are also eligible for the scheme? So what are the criteria to get it enrolled in this scheme?
Yeah. As I said earlier, the basic criteria will be the ration card that earlier used to be. But as we have universalized this scheme and everybody may not have a ration card, so he will need domicile certificate. Because as it is, the scheme is for Maharashtra. That is why it will be for the domicile of Maharashtra. Plus Aadhaar card would entitle him for the scheme. Whoever is the domicile of Maharashtra But in the case of accidents, anybody, irrespective of the state, is entitled for this benefit.
Okay, so it's not both ration card and domicile, it's either domicile is there, is entitled to enroll for this scheme.
Yes, exactly. Yes.
Yes, sir.
Yeah.
Sir, one more question means we have got a couple of queries. It's that how to enroll in this scheme, because there are many people who are not familiar about the enrollment. So how can they get it enrolled in the scheme with the domicile they are having?
Yeah. So the thing is, as I said, there are 1900 empaneled hospitals which are available on the website of this Mahatma Jyotiba Phule Jan Arogya Yojana. So whoever has any difficulty, whoever is desirous of any treatment, who is in need of any procedure, he can go to any of these hospitals directly. Okay. There will be a kiosk, there will be a facilitator. Okay. Yeah, and he will do the procedure immediately. He can on a mobile app take out your Ayushman card. Only thing you will have to produce the domicile or the ration card. So that entire thing will be done.
That is the second part, sir. Yeah. After the getting the Ayushman card, but first to enroll, how to get it enrolled?
See, there is no need for enrollment unless you need a treatment. Okay. You will need enrollment only if you need some procedure to be done. Okay. For that, it's best to go there and enroll.
Okay, so even so, in a simpler terms, out of 1900 hospital, if you want to get treatment, you have a domicile of Maharashtra, go to that particular hospital, you will get treatment. There is no prior registration or enrollment is required.
Correct. No, if you are not having any difficulty, thank God, then no enrollment is required. You go to a doctor only if you are sick.
No, there is any particular card of...
Ayushman card you can download from this Government of India's Ayushman Bharat app. Anybody can download that.
Okay, that will be applicable.
To have that COVID card during the unfortunate COVID times. It is similarly on the Ayushman Bharat portal. You can take out your own card. Okay. Yes.
So my final question would be, how much you are spending on this scheme per family, and means how much your insurance premium has increased, because now you have universalized this scheme, because you've been running this scheme from last few years, but now from 1st of July it has been a universal health insurance scheme, and which insurance company would be providing this scheme, and how much money state of Maharashtra would be spending on it?
Yeah. So today per family we are paying a premium of 1300 rupees, which means that the citizen doesn't have to pay anything. And as I told you, considering the number of families in Maharashtra, the expenditure for the exchequer will be around 3000 crores per year. That is the expenditure, and this is a rise of around 450 rupees from the earlier scheme, where the premium was 855. Yeah. So it's almost a huge rise in the premium to be paid for the health benefit of the people.
Thank you so much, sir. Pleasure talking to you, sir.
Thank you so much.